Okay, today we're talking about Bipolar Video 3 by Kevin and MTB. And could the thyroid cause bipolar? Well, right now we're going to talk about a lot of things that could cause bipolar disorder. And the thyroid is one of the newer, not necessarily more thoroughly developed reasons, but it is something to look at. First of all, where's the thyroid gland? Thyroid gland is located right up here in your, well, you can see the picture. The thyroid gland is right over here, if you can see my mouse cursor. And it delivers what we call T3 and T4 hormones to the body, and we'll get to those in a second. Presently, researchers are trying to correlate the link between thyroid overactivity and forms of bipolar disorder. Thyroid glands are known to have potentially large effects on mood and stability. The idea is that when the gland is active, the body metabolizes the hormones, which have a direct influence on the mood, functionality, and behavior in people and with psychiatric history. The following test was done to prove that the secretion of the thyroid gland is responsible for bipolar symptoms. The diagnostic scale among patients measure the comprehensive link between the patient and the bipolar disorders. The test was given to both the control group and 50 patients. The score for the control group was 1.98, while the group being administered the test exhibiting the bipolar symptoms scored 20.84. This is a monumental gap between the two groups. The lower of the two scores shows the average mean of the group of individuals as being within the range of the test subsidy for normality. So basically, it showed that the glands, specifically T3 and T4 hormone glands, were secreting hormones that were inhibiting people. Well, they were causing bipolar symptoms. Now, more studies need to be done on this. This is not a relatively new idea, but I still think more studies need to be done on this. Both groups would have the thyroid test administered to them. Goal to show the link between the levels of hormones secreted by the gland and bipolar disorder. Like I said, T3 and T4 were the ones that were studied in this group, and both displayed significant, as you can see the number 20.84 and 1.98. They show that the T3 and T4 hormone glands were secreting hormones that were playing a role in bipolar disorder. That's what this study showed. And in the Asian Journal of Psychiatry, and forgive me for mispronouncing this if I do, levothyroxine, a drug that was direct interaction on hormone produced in the thyroid, showed a link influence on effect on human behavior. Recent studies show ambivalence in the results. Although a clear area of further investigation, studies have yet to conclude in volume that levothyroxine is the best, if any, treatment for bipolar disorder. Furthermore, doctors are not knowledgeable about this type of treatment and are weary to subject a person to hormone treatment. Endocrinologists do not know enough about bipolar to use this drug effectively. Endocrinologists deal with diabetes and hormones primarily, but they are not at the level of the ability to successfully treat bipolar disorder. So this is really a kind of a new thing, this drug. Whether it's effective or not, we're not sure. Some people think it is, some people think it isn't. In conclusion, the study, along with countless others, clearly show ambiguity with the role the thyroid gland plays. There is something going on, most researchers hypothesize, but the inadequate funding, how long it will take to become progressive in the uncharted field of hormones. In one twin, the bipolar disorder, the chances that the other will develop are notably significant. It is about 40 to 70% chance that a twin will be affected by the illness. So genetics is another way to transfer bipolar disorder. A person with a single parent that is bipolar has a chance of 15 to 25% chance to inherit the illness. It is largely considered a biological illness, and although people hypothesize that neurotransmitters and brain differentiations along with chemicals lead to this factor. So there's numerous different observations. Nonetheless, serotonin, dopamine, and norepinephrine are considered links to the illness. It is connected many times that norepinephrine and serotonin are attributed to many psychiatric mood disorders, such as depression. However, many bipolar patients suffer from some degree of psychosis. Dopamine is the greatest link here, and researchers know that it is directly tied to our pleasure system within the brain. It is the disruption of dopamine that leads to the possible psychosis and illness such as schizophrenia. That is still a hypothesis. Keep that in mind. In the 2007 issue of Biological Psychiatry, it was reported that glutamate, an amino acid that deals with neurotransmitters, are significantly higher in certain areas of the brain. This study identifies the identification in bipolar disorders. Mood stabilizers are known to calm and put glutamate in a more dormant state of action. Melatonin and GABA are also believed to be involved in the process of this illness. And melatonin and GABA are naturally occurring hormones. Melatonin is I'm sure you've heard of melatonin. It's used to sleep. It's ineffective if used every night for most people, but it's a naturally occurring chemical in the body. The latest theories hypothesize hormones as perhaps the central cause, as everything else is tied into this with connecting factors. The idea of how medicine evolved to the effectiveness of the current standard is somewhat of a mystery. So we got a lot of different theories here. We have chemicals: serotonin, dopamine, norepinephrine. Dopamine is thought to cause psychosis. Psychosis can be delusional thinking, and we got GABA and melatonin in the brain, showing that there are possibilities that they're linked to that. And then we got the thyroid. So there are multiple issues that bipolar disorder could be linked to, and I think that they're all connected in some way or another. I think they all tie in to somehow link, or at least that's what the research shows. But this is just a little cap on what type of what science is doing in the field of bipolar disorder and what we should expect in the long run. All these should be investigated. To be honest with you, we know very little bit about norepinephrine, serotonin, and dopamine. They are the main chemicals that are involved in mood disorders, or so we think. But if you ever hear that you have a chemical imbalance, that is a stupid way of saying that you are mentally ill. It's another way of saying that we don't have a damn clue what's going on, because a chemical imbalance can mean so many different things. This is MTB signing off. Good day, good night, good mental health.